Hi, my name is Dr. Laura Anderson, and I'm a child and family psychologist who's been practicing 20 years or so now, and I have a business, Common Chord Psychology Services, and that was based on the idea that a common chord is a place where two circles intersect. And it's not an accident that a lot of work I do it brings together, bridges differences, navigates cultural differences, and just helps people think about their strengths and thrive in light of those differences, maximizing the benefits that come with operating in a way that people who are different or with people who are different from one another. And so it's in that spirit that I've started doing this series of conversations and consultations just as an introduction to my work with kids and families. And today I'm going to talk a little bit about the intersection of two of my areas of specialty, assessment and adoption. I spent a lot of time in adoptive communities with adoptive parents, and as an adoptive parent myself. And I know that there are a lot of people, a lot of adoptive parents, sitting with the deliberation about when to get a child assessed, whether to get a child assessed, and by whom. And in my experience, both professionally and personally, adoption is tricky in that having a child who's adopted absolutely does not guarantee that they're bound to have learning differences or coping problems. Um, that's not the case. And we know that adopted kids are overrepresented in special education settings and in clinics that do specialized work. And I think those of us who are parenting kind of understand that's probably due to a bunch of different factors. That would be a whole other talk. But today, I want to focus on how and when and why it makes sense to have an adopted child evaluated, and also really stress the importance of choosing a trained evaluator, somebody who gets adoption. And there are a lot of clinicians in my experience who say they do adoptive work, and they probably mean really well, and they've helped a lot of families over the years. And I think the more we learn, the more we know it's really a specialized area of intervention. I can say, as a psychologist who practiced classically for many, many years before I became an adoptive parent, a lot of what I had been applying and suggesting would need some tweaking to be helpful in my own home. And so I think it's really important to pay attention to, without demonizing or pathologizing, overly pathologizing our adopted kids. It's important to recognize that it's a distinct area of specialty for clinicians. And there are things that work and things that don't work, and work differently with different kids. So as always, when you're thinking about assessment and your adopted child, finding an assessor, finding a specialist assessor is really important. So starting there, if you have the luxury of being in a geographical area where you have a choice, absolutely finding somebody who has worked in the adoption community is paramount in importance. Adoption differences, developmental differences, trauma histories that may or may not accompany adoption, even trauma from children placed at birth. We know more and more through research and experience that separation from your primary caregiver, no matter if it's the instant you enter the world, can have an impact on sensory systems and developmental processes and emotional, spiritual ones as well. So we need a clinician, you need a clinician, an assessor who understands how that can impact children and asks pointed questions about the adoption history and the developmental history of your adopted child. And that's pivotal. Adoption differences often fall along the lines of some developmental differences, different timing of milestones reached, frontal lobe kind of issues, meaning executive functioning, planning, anticipation, organization, impulse control. And these things are a part of a lot of other diagnoses. So my experience has been that kids who have an adoptive history may be misdiagnosed, may be mislabeled with other things that can mirror some of what we know about trauma and early development. I also know that there are a wonderful, wonderful group of kids, challenging, wonderful group of kids who legitimately have a reactive attachment disorder. It exists, it's real, it's a thing, and I'll go out on a limb and say that I think people may jump to that too quickly sometimes with our adopted kids, and that there isn't always the most thorough understanding of how to be helpful once that diagnosis has been made, and if there are other ways to better explain the child's outbursts or the child's disconnecting from other people or the child's learning difficulties. That I think oftentimes ADHD and reactive attachment disorder are go-to diagnoses for children with adoptive histories, and absolutely it can be a very real part of an adopted child's functioning. But I think it's really important for adoptive parents to know to find clinicians who know how to tease out what could be early relational trauma, what could be anxiety, what could be learning differences because of executive functioning challenges, and not be ADHD and not be reactive attachment disorder. And if it is ADHD or reactive attachment disorder, be able to help specifically in the web of an adoptive family. So that's just a really brief overview as an introduction to why it's so important to find an assessor who gets adoption and who can think with you as a team and with your child about what situations are challenging for them, how can we help, what does an assessment help us with, and then most importantly, once the assessment's been done with an adoption-informed, trauma-informed, sensory-informed lens, that the implementation, the strategies that they want you to implement are going to be helpful at home and school, that there's practical advice for you and the school once you've gotten through teasing out what could be impacting your kids' functioning at school and at home. So with that, it's an invitation to find assessors and clinicians who have backgrounds, detailed backgrounds in adoption, to be able to be most helpful to your child and to your family. You can reach me at drlsanderson@gmail.com or www.drlsanderson.com. Thanks.